Folks, what you're about to see is parts of the Chuck Todd show. And Chuck's whole purpose, and George's whole purpose on their shows today, and Ron Manuel, and the strategy of the National Democratic leadership, Nancy Pelosi, and Chuck Schumer, and Adam Schiff, and Jerry Nadler, and the whole crew. Their strategy is try to make the president look like he's causing problems with the coronavirus. Now, anything they can do to attack the president and our Jared Kushner, who's doing a fantastic job, they're going to do that because that's what politics is all about in their minds. It isn't about working together. It isn't about getting and saving lives. It's about getting power back, and that's what they're intending to do. So just watch Chuck Todd's attitude and his questions and how he's trying to set people up as we watch parts of this show on the Sunday morning fake news series of George Stephanopoulos and Chuck Todd and media.
During coronavirus projection, hundreds of thousands of Americans dead under a best-case scenario.
This will be probably the toughest week between this week and next week.
Cases and deaths soaring fastest in the U.S. as guidelines are ignored.
I can tell by the curve, and as it is today, that not every American is following it.
Should there be a national stay-at-home order?
I don't understand why that's not happening.
Healthcare workers overwhelmed.
This is too much. How much longer can you do?
And states competing with each other for scarce equipment.
It's just a madhouse out there. It's like being on eBay with 50 other states bidding on a ventilator.
My guest this morning, Surgeon General Jerome Adams, Governors Jay Inslee of Washington and Asa Hutchinson of Arkansas, Prime Minister Giuseppe Conte of Italy, and author Michael Lewis. Plus the next crisis. What happens when COVID-19 hits rural hospitals that lack doctors, beds, and ventilators? And finally, scenes like this. The moments of love, selflessness, and heroism that are keeping our spirits up in the face of a once-in-a-century challenge. Joining me for insight and analysis are NBC News Capitol Hill correspondent Casey Hunt, former Republican governor of North Carolina Pat McCrory, and Helene Cooper, Pentagon correspondent for the New York Times. Welcome to Sunday and a special edition of Meet the Press.
From NBC News in Washington, the longest-running show in television history, this is a special edition of Meet the Press with Chuck Todd.
Good Sunday morning. The week began with two national reckonings on the coronavirus. The first is where we're headed. As of this morning, there are more than 300,000 confirmed cases in the United States and well over 8,000 deaths. The federal government is now acknowledging that in a best-case scenario, somewhere between 100,000 and 240,000 Americans are likely to die from this virus. One point of comparison, that's more Americans than died fighting in Korea and Vietnam combined. As you can see, the United States, that's the soaring red line in this graphic here, trails the world in flattening the pandemic's curve, perhaps the single most critical goal of all. Which brings us to the second reckoning, the government's performance. Like President Trump insisting for weeks that the coronavirus was no worse than the flu. Like the lack of testing, the big one.
Lies.
CDC test kits.
Lies.
The government's inadequate stockpile of ventilators, gowns, and other personal protective equipment. Like the mixed messaging on face masks, the CDC recommending
Lies.
the president refusing to wear one. Like disbanding the National Security Council's pandemic team in 2018. There are so many more, including one we're all responsible for, the failure to follow safety guidelines. Remember, those sobering death toll numbers hold only if everyone practices social distancing. And as we learned last week, that isn't happening everywhere. Still, the bottom line is the government has been telling us it's been in control of the virus. when in fact it is the virus which has been in control of us.
We are afraid for our patients. We're afraid for our families. We're afraid for our lives.
In New York and around the country,
we are a small rural hospital. We have no ventilators.
Medical providers, first responders, and state officials are pleading with the federal government for more help.
Every state is saying the same thing. I need help. I need assistance.
But this week,
where were you in your planning?
Repeatedly sent governors the message, don't look to us first.
The notion of the federal stockpile was it's supposed to be our stockpile. It's not supposed to be state stockpiles that they then use.
By Friday, the HHS website describing the national stockpile had been altered from saying it had enough supplies to respond to multiple large-scale emergencies simultaneously to reading its role is to supplement state and local supplies as a short-term buffer.
I don't know if Jared Kushner knows this, but it's called the United States of America. And the federal government, which has a stockpile, is supposed to be backstopping the states.
9 governors are still declining to enact stay-at-home orders, and Mr. Trump is refusing to direct them to do so, despite recommendations from his own public health officials.
I just don't understand why we're not doing that. We really should be.
The government's advice has changed over time. Americans were told not to wear masks. Now the CDC is recommending they wear non-surgical masks or face coverings in public. On Friday, the president immediately made it clear he is not going to follow that guidance.
You can do it. You don't have to do it. I'm choosing not to do it.
Americans were told only older people or those with compromised immune systems were at risk. In fact, 21% of deaths and nearly half of patients admitted to the ICU have been Americans under 65, according to early CDC data. Americans were told testing was widely available.
Anybody that needs a test gets a test. They're there.
Even now, there have been just 1.6 million tests conducted nationwide, a fraction of what experts say is needed. In fact, for months, the president played down the virus, misrepresenting the facts.
Not true.
Coming in from China, and we have it under control. It looks like by April, in theory, when it gets a little warmer, it miraculously goes away.
This week, he reversed course on his rosy projections.
Taken out of context, all this stuff.
Staggering, while attempting to claim
100,000 is, according to modeling, a very low number. Models show hundreds of thousands of people are going to die. You know what I want to do? I want to come way under the models. The professionals did the models. I was never involved in a model, but at least this kind of a model.
And joining me now is the U.S. Surgeon General. It's Vice Admiral Jerome Adams. Admiral Adams, welcome to Meet the Press. And let me start with, you're the Surgeon General. Give us your recommendation on face masks.
Well, it's important for America to understand that originally the CDC, the World Health Organization, and my office all recommended against the public wearing face masks because the best available evidence at the time suggested that they were not impactful in preventing you from catching a disease if you were the individual wearer and you were healthy.
Right.
We always recommended that if people had symptoms, that they wear a face mask to prevent spreading disease to other folks.
Right.
Here's what's changed. We now know that about 25%, in some studies even more, of COVID-19 is transmitted when you were asymptomatic or pre-symptomatic. And so the CDC has now recommended that people wear cloth face coverings when they're going to be out in public and they can't be more than 6 feet away from each other. But here are the important points really quickly. Number one, you need to make sure you're not substituting social distancing with face masks.
Right.
Because the most important thing is still to stay away from people. Make sure if you put on a face mask, you don't touch your face and you don't and you wash your hands before you utilize it. And number three, say that the medical masks for the healthcare workers.
That's right.
Excuse me. They need them. They absolutely need them to be able to respond. I have a video out where I made a cloth face mask out of a T-shirt.
Yeah.
And rubber band.
Right.
Anyone can do this. We all need to do our part to get through this.
I'm curious, I know you made the warning, you're saying you don't want people to make a run on clinical or surgical masks.
Right, Chuck.
Two questions I have on that front. Number one, if you are caring for somebody in the vulnerable age group, should that person be wearing a surgical mask? And second, if there were enough around the country, would that be the recommendation? And is it the only reason we're saying do homemade ones is we just don't have enough masks?
Well, the reason why we're saying make a homemade one is because that's effective in protecting you from me. Remember, I'm wearing a mask to protect you, Chuck, and you're wearing a mask to protect me. That is what you need. We want to make sure we're saving the medical mask for the healthcare workers, and we still wouldn't recommend that people wear an N95, even if we had enough. When I'm in the hospital, I have to get specially fit tested to wear an N95. They're uncomfortable, and you can frequently touch your face. If you're taking care of a loved one who is either older or has medical conditions, very important you wash your hands frequently. You do everything possible to prevent spreading disease to them, and I would encourage folks to consider wearing a cloth face covering when you're within 6 feet of that person so that your droplets aren't going to them and you're not potentially spreading disease.
Now, did you hear it, Chuck?
Would you recommend people wearing one at work?
That again, so here's what you have to know. If you go to the CDC website, it says, number one, this is voluntary. We're asking people to think about doing it to protect their neighbors and their family. But number two, it's not a substitute for social distancing. If you're at work and you're 6 feet away from someone, there is a minimal chance that you're going to spread disease. If you're in a work environment where you're within 6 feet, where you're really close to someone, that's definitely something to consider. And again, that's what the CDC guidelines actually say. They're based on the science. We always try to evolve our recommendations based on
right, Chuck. Read the website.
Well, I know you're hesitant to backseat drive other officials in the calls that they have to make, and I'm very aware of that. But I am curious, if you were advising the 9 governors who have not issued stay-at-home orders, what would you advise them to do?
Well, I would advise them to follow our 30 days to slow the spread guidelines. I ran a State Department of Health. I've talked to many of these governors, and here's what I say to them. Here's what I would say to them right now. The next week is going to be our Pearl Harbor moment. It's going to be our 9/11 moment. It's going to be the hardest moment for many Americans in their entire lives. And we really need to understand that if we want to flatten that curve and get through to the other side, everyone needs to do their part. 90% of Americans are doing their part, even in the states where they haven't had a shelter in place. But if you can't give us 30 days, governors, give us a week. Give us what you can so that we don't overwhelm our healthcare systems over this next week, and then let's reassess at that point. We want everyone to understand you've got to be Ruthie the Riveter. You've got to do your part.
Now get it, Chuck?
It sounds like at a minimum you wish every governor would issue at least 1 week.
I wish every governor would encourage the people in their states to...
You can't get it, can you, Chuck? You're trying to put words in his mouth.
But I want them to do what they can within their states. We know that from a public health perspective, and I ran a...
All political.
Whether it's smoking or opioids, there are all sorts of different rules and regulations in different states. You remember just last week, which was forever ago in Corona time, Governor Cuomo actually said it would be declaring war on the states to issue a federal quarantine. Governors are rightly protective of their ability to determine what's best for their citizens. We want them to have the science to make the best recommendations.
I want to put up a quote from Amy Acton. She is the Director of Public Health in Ohio. She said this on March 13th. And Admiral, it has been haunting me ever since. And this is what she said. On the front end of a pandemic, you look a little bit like an alarmist. You look a little bit like a Chicken Little. The sky is falling. And on the back end of a pandemic, you didn't do enough. Are those words that we should all be living by, which is, you may be hesitant right now if you're a leader about debating health versus the economy. Hindsight, you're going to wish you had done more.
20 years in public health, and I know Director Acton, those words couldn't be truer. We are always telling people we would rather prevent disease than treat disease. I tell people we aren't going to treat or supply our way out of this problem. There is no magic bullet or magic cure. It's good old-fashioned public health and prevention, everyone coming together, practicing good hygiene, staying at home, doing the things that we've always told people to do to prevent spread of infectious disease.
And that's exactly what President Donald Trump and Mike Pence are doing, Chuck.
Like was advertised a couple weeks ago, where we can get a test, where we can find out about these antibodies, because it seems clear we're never reopening this economy fully until we're able to GPS this virus. Where are we in testing, sir?
1.6 million tests, and you mentioned that. That's about 1 in 200 Americans. That's where South Korea was with their initial testing surge. We're seeing testing ramp up, particularly with the Abbott rapid test. And we know that it's never enough tests fast enough, but I feel confident that within the next 2 to 4 weeks, we're going to be where we want to be able to do adequate surveillance and understand where the disease is, where it's high and low, and and to have appropriate public health recommendations. But what does reopening look like? We want to make sure we're seeing cases go down for a good 1 to 2 weeks in places. We want to make sure we've got testing, but we want to make sure we've got good public health infrastructure so that when we identify a positive test, people can then follow up, isolate, follow up on their case contacts, and make sure a single case doesn't turn into 10, 100, 1,000 cases.
Absolutely.
Do you think by the end of
Great
April
person.
we'll be in a testing situation where we're actually doing surveillance rather than just trying to play catch up?
We are doing surveillance in many places. Montana, for instance, actually has a higher testing rate.
Sorry, Chuck, it's not going to work. This guy's smarter than you are and much better prepared. And he's not political.
Antibody testing out there, which is going to give us more information. And I talked to Admiral Giroir, who's the head of the testing task force. He said he feels within a month we'll have antibody testing more widely available. Again, 100,000 tests being done per day, 50,000 Abbott tests coming online. America testing is becoming more and more available, but it still doesn't replace the fact that we want everyone to act as if they have COVID-19 right now and protect your neighbor, protect your loved ones.
That's right.
Very quickly, Admiral, the president mused about a one-day reprieve for Easter Sunday. I understand it from a hopeful.
You don't understand it at all, Chuck.
A public health mistake.
The president is always hopeful, he's aspirational, and we're trying to give people the science. The science says that right now, this Palm Sunday, and I'm a Catholic, I would ordinarily be getting ready for church right now, we need you to stay at home. This is going to be a hard week, it's going to test our resolve, it's going to be the hardest week of our lives, but I'm confident based on the numbers in Washington and in California and Italy and in Spain, we can get through this, we will get through this. I know the American people will do the right thing and stay at home.
Right.
Surgeon General Jerome Adams,
a great man.
Stay healthy.
Sorry, Chuck, it didn't work.
People do watch your video on how to make a mask. Thanks for coming on and
watch it. Stay home. If you go out, use one of these. Thank you, Chuck.
All right. Thank you, sir. And joining me now are two governors who've taken very different steps in the face of the coronavirus pandemic.
Yeah, they're political.
Inslee of Washington State, the first state to be hit hard. And it's Asa Hutchinson of Arkansas, one of the few governors who has not issued a stay-at-home order. Gentlemen, welcome back to Meet the Press for both of you. Governor Hutchinson, I want to start with you. You heard the Surgeon General there. He's pleading, give him a week. He'd prefer, if it were all 30 days of this month, your response to the Surgeon General.
Great comments by the Surgeon General in Arkansas. We're doing everything that the Surgeon General has outlined, plus more. For example, I applaud the recommendations on masks. Yesterday, we issued guidelines that if you go out, social distance first of all, but bring a mask with you in case you get in environments you cannot have that 6 feet spread. In Arkansas, we have a targeted approach that is very strict. We've closed bars, restaurants, schools, some of our park lodges. We're emphasizing the social distancing, and we will do more as we need to. But let me give you an example of why the masks are so important. And by the way, we have had success in Arkansas comparable to other states, in fact, beating and slowing the spread more than in some states that have actually had a stay-at-home order. But you have a stay-at-home order, tomorrow 600,000 Arkansans will still go to work. So it's more important, the message that do your social distancing, don't gather in groups of more than 10 people, and bring a mask with you. I'm going to be following that instruction. If I can't social distance, I want to have a mask on. We just had last night a breakout in one of our federal prisons here in Arkansas that has 10 inmates that tested positive and 4 guards. That's a federal facility. But stay at home doesn't help there. You've got to have the mask. Right. And our state prison is producing masks that we can utilize in our state prison environment. Those are some of the things we're doing. We'll do more as we need to, listening to our public health officials.
All right. Governor Inslee, all week long, Dr. Birx has basically used Washington and California as examples of trying to show the country, look, this can work. This social distancing can work. It's hard, but look at what's happened in Washington and California. I know you have said you're not out of the woods, but do you believe you have started to flatten this curve?
Yes, the evidence that Dr. Birx has pointed to repeatedly does demonstrate we have had some success flattening the curve. That has taken place because we acted relatively early. We had a staged way of moving forward. We're in one of the most aggressive stay-at-home, stay-healthy initiatives in the United States. And I think this has a reason to believe it's been demonstrably successful. And I'm glad we got on it relatively early while the president was saying that this was not a problem, I mean, it was a hoax. We were acting to save...
He didn't say that at all.
In a number of states.
That was a lie.
In Washington State. It's pleasing to know that if you act aggressively, and if you realize that even though you're looking okay today, it can bite you big time tomorrow. I think that's one of the wisdoms. I think it would be good to have a national stay-at-home order. And the reason is that even if Washington gets on top of this fully, if another state doesn't, it can come back and come across our borders 2 months from now. So this is important to have a national success. But I want to reiterate, we are a long ways away from being out of the woods. Yeah. We have not got down to anywhere close to where we need to be to declare victory of this horrendous virus.
What does, Governor Inslee, I want to start with you on this first. Have you started the conversation about what metrics you'll be looking for to start lifting some of these stay-in-place orders?
Yes, but those are just only to begin to think about this because we have been so intent on making sure this is a successful stay-at-home order. And so far, it has been. We have had huge compliance in our state. Washingtonians are responding to the call, and we're really happy about that. But yes, we are looking at the metrics. Fortunately, we're very fortunate here in Washington. We have the University of Washington labs, some of the best in the world, and they give us the metrics that we need. We watch these like daily or hourly, and we will look at them on a mix. There isn't one number. There are many numbers we'll be looking at to see when we can come out of this. I've extended it a month, just 2 days ago, to May 4th. So we are in a very vigorous, one of the strongest, probably the strongest in the nation, to May 4th at the moment. But we have more work to do.
Governor Hutchinson, there was the CEO of the University of Arkansas for Medical Sciences in the medical center there, said the state lost an order of 500 ventilators. He essentially got outbid by another state. Should you be in that situation? Should you be forced to be bidding against? Is this something the federal government needs to step in and handle?
Well, it's difficult, and we have had circumstances that we're trying to collect our PPE, our protective masks, and we've been outbid by another state after we had the order confirmed. So yes, that has been challenging for us, but we recognize that the federal government has said, we're your backstop, you've got to get out there and compete, and it literally is a global jungle that we're competing in.
Do you think that's the way it should be? You think that's the way it should be? I mean, look, I know ideologically...
Oh, Chuck, quit trying to...
Where a lot of people believe in federalism, but in a moment like this, should this be the case, states competing?
No, there needs to be they'd like to see a better way, but that's the reality in which we are. We put $75 million to do our procurement, and we'll work through this. The federal government's made it clear they are the backstop. And if we need more ventilators right now, they're going to be going to the hot spots, New York and California. But I've been assured that when we get to the point, if we need ventilators in Arkansas, they're going to be there. We're not waiting on that. We're going out in the marketplace. We're trying to buy ventilators.
Absolutely.
You know, whether it should or shouldn't, that is where we are right now. Let me come back if I can, though, and I want to compliment Governor Inslee. I think we're watching his success, some of the things that he's done there. But I would point out that even in the stay-at-home order, that's one of the most stringent, as he points out, in Washington State, you can still go buy your marijuana. And that's why it's important that we add to that social distancing and the mask that we're advocating if you can't social distance. And that's why every state, whether we're procuring or whether we are determining what's best in our state to reduce the spread, we have to be able to have some flexibility making those decisions, and that's what we're seeing. We're learning from each other.
Well, very quickly, Governor Hutchinson, I want to give Governor Inslee a chance to respond to that. But Governor Hutchinson, Anthony Fauci has begged basically for a national stay-at-home order. Does his basically begging for this at all have an impact on you to change your mind about this?
He's just looking at the nation as a whole, and as the Surgeon General said, this week is critical, and we are doing everything that their guidelines say. They mentioned the mask. We're leaning forward even more in that regard. And so we're all pulling together on this. But whenever you look at our state, I think Governor Fauci, Dr. Fauci, would be very pleased with the fact that we are beating some of our other states in reducing the spread and the commitment that we have to working every day to accomplish that.
All right, and Governor Inslee, very quickly, is the relationship with the federal government getting better week by week?
Well, look, we've had good communications with the Vice President, with
yeah, listen to that, Chuck.
Those have been good. But this is ludicrous that we do not have a national effort in this. To say we're a backup, I mean, the Surgeon General alluded to Pearl Harbor. Can you imagine if Franklin Delano Roosevelt said, I'll be right behind you, Connecticut. Good luck building those paddle ships. Look, we need a national mobilization of the manufacturing base of the United States as we started on December 8th, 1941. We need to nationally mobilize using the Defense Procurement or Production Act so that we can get these companies, instead of making cup holders, start making visors, start making test kits. We don't have enough test kits by far in my state or anywhere in the United States. So we, governors, Republicans, and Democrats have been urging the president to do what he should, which is if he wants to be a wartime president, be a wartime president. Show some leadership. Mobilize the industrial base.
That's exactly what he's done.
Governor Jay Inslee, Democrat from Washington State, Governor Asa Hutchinson, Republican from Arkansas. Thank you both for coming on, sharing your views. It's going to be a long fight here. Good luck to both of you on the front lines there. When we come back, Italy was the first European country hit hard by the coronavirus. I'm going to talk to Italy's Prime Minister about what the United States can expect to see in the coming weeks. And as we go to our break, all morning, we're going to try to show you some uplifting scenes, beginning with firefighters cheering workers at New York Presbyterian Hospital.
Most manufacturers, in fact, 95% of them, will do what the president and the senators and congressmen and the committee ask them to do. You don't have to declare the National Defense Act to force them to do it. Now, occasionally you will run across one who tries to break the rules, like the one company did, M. And they 3M, and they tried to make a profit off of manipulating their products. And when that happens, you have to put your foot down like the president did. But many other manufacturers and companies have come in to help freely and doing a great job.
First European country devastated by the coronavirus. On March 4th, Italy closed its schools and universities. On March 8th, most of northern Italy was placed on lockdown. And one day later, the lockdown was extended to the entire country, something we have not done yet here. Did it work? Since its number of new cases peaked on March 21st, Italy has seen an unsteady but a decline nonetheless of new cases. So what can we in the United States learn from Italy's experience? Joining me now is Italy's Prime Minister, Giuseppe Conte. Mr. Prime Minister, welcome to Meet the Press. And let me simply start by asking how you and your citizens and your own loved ones are handling all this. This has been a very trying time. I know you've just lost a bodyguard to this deadly virus.
Unfortunately, it was a terrible news. But let me say one thing first. We are suffering very much. More than 15,000 Italian lives lost to their dear ones, to our society, to our nation. It's a devastating pain. And in these difficult times, I can openly say that America and President Trump once more have proven to be Italy's true and loyal friends. I want to thank President Trump, who immediately made us feel his support, his presence. And I'm very grateful to American people for this.
That's right.
About what is known today as the Italian model, I can say, first of all, since the very beginning of the pandemic, Italy has put public health first, and for this reason we have adopted very strict measures that you mentioned and adjusted them to the evolution of the infection. Second, the political choices must be based on scientific evidence. Third, it is crucial to implement decisions with full transparency. Our liberal democracy is built on the contract we have with our own people, and we owe to them truth and transparency in the same way we have to provide them with safety and security. This is the Italian model.
Do you believe, given what we've seen, and it looks like you have flattened your curve, do you believe that you have flattened the curve because of these tough measures you've taken? Or do your scientific experts believe the virus might be just running its course?
In this moment, I cannot say when the lockdown will stop, because we are following the suggestions of our scientists that are in the scientific and technical committee. But you have to consider that Italy has been the first country in Europe that, of course, faced this pandemic. Our response has not been perfect, maybe, but we have been acting the best of our knowledge. Today I see that our model is implemented by the countries and its validity has been acknowledged by the WHO. And the results so far indicate that we are on the right path. Therefore, the most important message to give to our citizens is stay home as much as possible. Do not go out. And if you must leave your home, for example, to go to work or to buy food, always respect our safety rules. We are asking our people a great sacrifice. I'm aware of it, but it is the only way to defeat the pandemic altogether. The more we respect the rules, the sooner we will get out.
It sounds like there was a story in the New York Times today that if with testing, that you're hoping in your country that in order to reopen parts of the economy and reopening parts of the country, that if you might be able to have, okay, if you have the antibody to the virus, you can work, and if you don't, you have to stay home. Do you think that is in Italy's future?
We will work for that, but in this moment we are all in the same battle. We are fighting the same powerful and invisible enemy. All countries in the world are hit, and we are all in front line. If an outpost withdraws, the virus will spread again, and our efforts and sacrifice would be in vain. For this reason, it's crucial the cohesion and cooperation of our democracies, and it's strategic, the international collaboration. And it's strategic also that all conflicts around the world should stop. Italy strongly supports the appeal made by the Secretary General of the United Nations for a global ceasefire. It is time for all the parties in conflict to stop fighting each other, a unit against an enemy which wants to make a difference and will kill them all.
Right.
Mr. Prime Minister,
fight the disease and not political parties.
It's difficult to think of these empty churches on Palm Sunday, and on Easter is going to be very difficult. My condolences again to you, and stay the fight. Keep going, and keep flattening that curve. Thanks for coming on.
Proud to serve my amazing, unique country. Thank you very much.
Negativism here. In other words, let's put blame someplace and try to put it on the president and Jared Kushner and the team. Chuck's way of politicking for the Democrats.
Their remote locations. We are practicing our social distancing. NBC News Capitol correspondent Casey Hunt, the former Republican governor of North Carolina, Pat McCrory, and Helene Cooper, Pentagon correspondent for the New York Times. All right, I think we can best sum up the argument or the debate this morning in particular, which is who's in charge. And Casey Hunt, I want to play the president on those CDC mask guidelines, because in many ways The mixed messaging he sent here sort of sums up this sort of back and forth between the feds and the state.
It's not a mixed message, Chuck. It's volunteer.
Non-medical cloth face covering as an additional voluntary public health measure. So it's voluntary. You don't have to do it. I don't think I'm going to be doing it. I think wearing a face mask as I greet presidents,
taking him out of context on what he has to say.
Kings, queens, I don't know. Somehow, I don't see it for myself.
It's worth noting, by the way, that the Italian Prime Minister, before he started the interview, before he sat down, he actually was wearing a mask. There were all of his aides were wearing masks. We thought that was interesting there. But Casey Hunt, this seems to be this push and pull here. The governors want the feds to take more control, and the president definitely doesn't want to do that.
And even Asa Hutchinson, in your conversation there, he's resisted that statewide stay-at-home order, as you pointed out. But he also said in that interview he was going to be wearing a mask and modeling the guidelines. The Surgeon General, just a minute earlier, putting a face mask on camera. Clearly, our public health officials believe that this is a message that they want to send to people in the strongest possible terms. And this is, of course, an evolution. We were initially all told this wasn't necessary unless you were sick. But at this point, you know, what the president is saying, Chuck, we're seeing it in any polling that's being done. We're seeing it in how people are responding. More people are listening to what this president has to say than have at all yet in his presidency, because we are all tuned in trying to figure out how to make our way through this together. And so if he wants Americans to wear masks, he needs to say that very directly. And we all know, especially those of us who are trying to raise children, that you have to model the behavior yourself to convince others to follow.
It's voluntary.
As a former governor, as a former mayor, I know you're sympathetic to somebody above your pay grade trying to tell you how to run your state or run your city. I get
right.
That. But when is the point as a governor that you actually want the feds in charge?
Well, one thing, I've been in the fog of war during hurricanes and tornadoes and winter storms where you're making life and death decisions while balancing the economy and also balancing the turf between not just the federal government and state government, but if I think you examine every state, there's turf among the county health directors and the governor. And as you get closer to the people and the elected officials are closer to the people, there can be varying opinions. And in the fog of war, you have mixed data, you have mixed communication, and you have evolving opinions based upon that.
That's right.
And that's exactly what's happening today. The one thing I don't like that's happening is the blame game.
Right, Chuck.
You know, the Washington governor mentioned Pearl Harbor. Well, I think after Pearl Harbor occurred, the worst thing a governor could do is blame Franklin Roosevelt for Pearl Harbor. What you need to do is go, what do we need to do now? And be specific. And we all live in our lanes of responsibility, and some of those lanes overlap, and they're gray areas. And this is not unusual in a fog of war.
Right.
I'm just curious, though, Governor, I want to follow up. I'm obsessed. I put that quote up for the Surgeon General, the public health official from Ohio, Amy Acton. Are you surprised that more politicians aren't erring on the side of caution here? Because there seems to be, if you're wrong about this, boy, is that a bad way to be wrong. If you're wrong and you've been overly alarmist, well, nobody extra has died. But if you're wrong and you've underplayed, boy, you've got a lot to answer for.
I had a theme during our crisis and hurricanes was be over-prepared and hopefully be underwhelmed. And that, I think, should be the goal of every leader. But there is this tremendous balance that we all have. And one thing about even the stay-at-home policy, I could say it almost discriminates against the blue-collar